Hi there, I'm Dr Martin Benfield, I'm a GP trainer, and this video describes how to write clinical case reviews that use the capability ethics. A lot of people find writing ethical case reviews difficult, but they don't have to be if you use a system to write them. You obviously need to write the clinical case reviews with the ethics capability to pass your ESR, but writing them can be a really good way to improve your consultations. Analysing situations that were not easy or where you had to discuss a choice will enable you to be more in control in future consultations when similar situations present themselves. This is important for real-life consultations and also the SCA exam, where you would expect some of the consultations to involve a difficult discussion. Difficult conversations are made a lot easier if you can verbalise the situation for the patient to make an informed choice. It is usually up to the patient to make the decision that is in their best interest. Your job is to enable them to be able to make a choice by giving them an explanation and options in a way they can understand. There are a lot of consultation skills required to do that, which are discussed in some of my other videos, such as negotiating and explaining diagnoses. To be able to manage a difficult discussion, you will need some clinical abilities, such as knowledge of the condition, knowledge of the treatment options, and experience in explaining these to patients. You'll also need some patient abilities, such as how to ask ICE questions, how to adapt management plans to fit with the patient's unique situation, and experience doing this in real consultations. Two good ways to improve your ability to do this are to record your consultations to be able to analyse them with your trainer. The other is writing your recollections of the consultation in a clinical case review to analyse what happened and why. You don't need to have a serious ethical situation to use the ethics capability. Any case where a choice needed to be made can be analysed using an ethical framework. Ethical frameworks divide the problem up, making it easier to analyse, and I use two ethical frameworks. The first is benefit, harm, autonomy, justice method. You take the situation you are analysing and split it into 4 sections. Number 1 is benefit. What good could come from this decision? Second is harm. In what way could this decision lead to harm? The third is autonomy. What involvement did the patient have in this discussion, and were they helped make an informed choice? And the fourth is justice for all. Is it feasible for everyone in this situation to receive the same resources? For example, the time you spent with the patient, the cost of medications, doing a referral, the investigations. The second ethical framework splits the situation up so that you look at it from different people's point of view. Step 1 is to think of the people that are or could be involved in the situation. It will always be you. There will always be a patient, unless the patient is a very young child, and then choose 2 or 3 other people who you think might be affected by the decision. For example, family members, the receptionist who might have an angry patient talking to them, the doctor to see the patient next, who might be at the practice, might be in out of hours, the local pharmacist, etc. Then step 2 is to write down what you think are the thoughts, emotions, impact of the consultation on these people. Easiest to start with yourself. What did you do and why did you do it? What evidence was this based on? Did you explain it in a way the patient could understand? How did you feel during the consultation? What are your thoughts on how you performed? For the other people, you're having a hypothetical guess at what you think might be other people's thoughts regarding the event. Put yourself in their shoes. Try and imagine being that person. Start with the patient. What health beliefs, such as ICE, did they have, and why did they think these things? If they didn't agree with your diagnosis or didn't agree with your initial management plan, why was that? How do you think the patient felt before, during and after the consultation? Now we get more hypothetical. How do you think your decision might have affected some other people who might be involved. For example, how would the decision affect the elderly lady's daughter who helps look after her, or your GP colleague when they come back next week to be seen again because they didn't get what they wanted? When I write an ethical reflection, I use the different people's point of view framework. But within that, I make sure I include what good or harm might the decision cause, was the patient enabled to make an informed choice, and is this fair for myself, the practice and the NHS? As with all clinical case reviews, try and use 3 capabilities per log. Choose whatever you think is most appropriate. Could be communication skills to describe how you ask the question, to data gather and other skills to negotiate the consultation. Could be holistic care to describe what ice you found and other patient-specific factors and how you use this. Could be clinical management to describe what your plan was and why. Could be managing medical complexity to describe the uncertainties and how you explain these to the patient. Then we get to the reflection section. This is really important. Having thought about the case, how do you now feel about how you conducted the consultation? What would you do differently and why? If you look at any differences in opinion between you and the patient, could you have predicted this from the better ICE data gathering and adaptation of your initial plan for the patient's views? Could you have verbalised the situation differently so the patient was making an informed decision when you first described the plan? Now thinking about how other people might have been affected, does that change what you would do in the same situation again? You can write a clinical case review like this for any consultation where you felt uncomfortable. For example, when the patient does not agree with your first choice plan, or because there was some level of risk. For example, a young person wanting to be prescribed antidepressants, or a person wanting the pill or HRT when there may be some risks. Let's take a simple scenario as an example. The brief description I'm going to write is: I saw a 3-year-old who had signs of a cold for 3 days, was brought in by her gran as her mum was at work. I thought it was viral, described why, and gave a safety net. I found out a few days later the mum had brought the child in the next day, despite not being worse, and reported being unhappy that no antibiotics had been given first time. The GP gave a delayed prescription. Under data gathering or making a diagnosis, you could describe the timeline of the symptoms, the exam findings, and your interpretation of what this data means. What was your evidence for your viral diagnosis rather than bacterial? Under managing medical complexity, describe any uncertainty there could be with the diagnosis. Describe how you explained the evidence that showed it was likely to be viral and why antibiotics would not be likely to help. What was the exact safety net that you gave, including what symptoms and time frame for review? And then under the ethics capability, you can split this up into either the good, harm, autonomy, justice framework, or different people's point of view. The different people here are yourself, the gran, the mum, and your GP colleague. The issues to analyse are no antibiotics versus delayed prescription, and what else could you have done differently to not have an unhappy mum coming in the next day? Some things to ask yourself are, what was the possibility of antibiotics actually really helping here? Do you know a number needed to treat for this type of infection? Could this evidence have been described more fully? Did you describe the potential harms of the antibiotics? What were the costs here in time and money, the prescription, the pharmacist's time, and the fact the patient has used up another appointment? The gran told you mum wants antibiotics, but did you ask why? And could that information have been useful? How do you think gran felt going home knowing she didn't have the antibiotics? How much information you gave gran do you think she retained and then passed on to mum? Could you have printed the notes or called the mum? Did you describe the natural history of the condition to explain what you expected to happen next? Could you have been more specific with the safety net instructions of when antibiotics might be needed? How do you think your GP colleague felt with this patient coming in to see them? What do you think of their notes? What do you think of their decision to prescribe? So as you can see, there is a lot of analysis that you could do on even this simple consultation. By thinking about what you did in the consultation, what the patient or the family may have been thinking, and the effect on the other people. This should give you more understanding and empathy for other people and help you to structure your explanations in consultations, because you can take those factors into account. Next time you have a similar situation, you will be more in control of the discussion. Difficult discussions can change from being something that is feared to something that feels like you've done a really good job. I hope this is helpful. Good luck.